Again, I want to welcome everyone. My name is Roni, and I work as the Child and Family Program Manager at the Mental Health Association of Maryland. And I oversee our Healthy New Moms program, which focuses on raising awareness about all things perinatal, mood, and anxiety disorders for moms in Maryland and beyond. Welcome to our March webinar series. I'm super excited for this topic today. And just to share a little bit, we will be recording today's session and it will be made available to you in the coming week. We'll talk about it more at the end, but certificates of attendance are available and more information will be shared. So, regarding our webinar topic for today, nearly 1 in 5 mothers experience a perinatal mood or anxiety disorder, and emotional stress can directly affect milk letdown supply and feeling confident. This webinar brings those connections into focus by blending clinical insight with real-world guidance on how emotional wellness shapes breastfeeding success. Together, we will explore the physiology of stress and lactation, recognize common maternal mental health symptoms that may arise during feeding, practice trauma-informed communication strategies, and build hands-on skills and hand expression to strengthen family wellness and confidence. And so I'm so excited to announce our speaker for today, Cynthia Sparks. Cynthia is a maternal child health nurse with over 20 years of experience supporting families through pregnancy, birth, postpartum recovery, and lactation. She is the founder and administrator of Mainline Maternity Care, a maternal wellness and home health agency serving families throughout Maryland. Cynthia's professional certifications include maternal newborn nursing, case management, breastfeeding counseling, international partnership for perinatal excellence, and perinatal mental health provider designation through PSI. Cynthia's expertise spans from pregnancy through the postpartum period and beyond, with perinatal mood and anxiety disorders, lactation counseling, trauma-informed care, family support systems, and culturally responsive maternal health education. Cynthia has partnered with community agencies, early childhood programs, and Maryland family support organizations to strengthen maternal mental health and breastfeeding resources. Her teaching style is warm, relationship-centered, and grounded in evidence-based practice. She helps families feel seen, supported, and empowered through the vulnerable postpartum period. And so, Cynthia, thank you so much for being here, and I will pass it over to you.
Thank you so much, Romy, for that great update. I appreciate that. And welcome to everyone that is here today. As Roni introduced it, I am certainly here to provide a little bit of education, a little bit of support, and hopefully a tool that you guys will be able to leave here with today to better support moms. Now, the framework that I use today is grounded in 3 major influences. One, by a guru in the breastfeeding world, Miss Diane Spatz. And her approach is to protect the dyad, that mother and child, protect the milk, and protect the gut. Because of the teaching that she provides and being a breastfeeding counselor, I lean on those gurus to make sure that I am giving the most accurate and up-to-date information. I am also supported by Postpartum Support International. I am a member of that organization. And in that role, we want to promote screening, we want to promote treatment, and we do it in a way that does not shame the individuals that we're there to help and support. And then, most recently, with the Maryland March of Dimes, Mainline Maternity Care participated in the Maryland March for Change to advocate for moms, infants, and the changes that we need across our great nation and globally as well. So again, thank you all for being here today. And before we move further, I just want to say that this is a respectful space. We want to protect and promote safety and security. If there's individuals who do decide to share, whether in chat or coming off live, certainly let's just be respectful as everyone's experience and journey does differ. Okay? You will hear me use terms like mother, father, and partner, and that's because Much of the research and policy language is written in that manner. However, I do understand and respect that many people do identify in different ways. Our goal here is not to label, but to offer support. And I also want to hold a special space for grandparents who have stepped into helping really caregive for those early days and for those small babies. We appreciate their support as well. So, lactation is not just about the breast process, and that's what we want to kind of dig into today. It is a brain, breast, and baby neurohormonal loop. And when that loop is supported, families really do feel more regulated. And when that loop is disrupted, is when stress, trauma, sleep deprivation, lack of support, and anything and everything else that comes in that mix can amplify anxiety, depression, and breastfeeding challenges for that dyad. So, nothing that we discussed today exists in isolation. This is a physiology, a psychology, and a system supportive care topic. And our job is to protect it all. So you guys can advance to the next slide, please. Thank you. So why this matters? Well, again, we just indicated this is not just about the physical aspects of breastfeeding, but also emotionally, clinically, and systematically. So let's start with feeding. Most US infants begin life receiving breast milk, and studies show us that about 86% are ever breastfed. But we do see that number drop off when it comes to exclusivity, how long that mother breastfeeds, and if there is early formula introduction or not. Why do these declines happen? Usually because parents don't necessarily have the support that they need. It could certainly be because of mental health and emotional health concerns. It could be related to latch and pain issues. There are a number of reasons. However, we want to assess and correct as much as we can. Parents don't make the decision to breastfeed and then decide, okay, this is not what I want to do. If they have the support, the education, and the information, they can certainly do this and be successful at it. Nationally, about 1 in 10 babies are born premature. And unfortunately, here in the Maryland area, the Maryland March of Dimes gives us a D plus for that report card. Not ideal when we're thinking about that as a grade, right? We could do much better in terms of the preterm rates, but that also does take us into how we are feeding those preterm babies. So we'll talk a little bit about that as well. And prematurity matters because early birth compounds feeding challenges, right? Increased NICU stays, heightened vulnerability for moms, their caregivers, their partners, and the babies. So this can be a very overwhelming and emotionally challenged time. And from a who does this affect the most perspective, here in Maryland, Black birthing people and families with fewer resources continue to face significantly worse preterm and breastfeeding outcomes. And this is a reflection of systemic inequities, not biological. So we'll talk about that in a little more detail as well. And we'll go into more detail as it relates to perinatal mood and anxiety disorders. So when we talk about breastfeeding and when we talk about mental health, we want to talk about them together, not separate. Most parents intend to breastfeed, but sustainment is uneven. And when those challenges present, we can do a little bit better in terms of helping and support. Next slide, please. Thank you. And so today, in terms of our learning objectives, by the end of this session, we hope that you guys will gain a little bit more emotional wellness insights and its impact on postpartum mental health. We hope that we can provide and give you information for effective communication when it comes to supporting these families. And overall, we hope to strengthen the ability to provide holistic breastfeeding support. Again, the mind is in this process. So it's physical as well as emotional and mental. And then the last thing is we hope to provide you with one tool or practice that you can help families initiate in the very early days after birth. So while they have colostrum and before their mature milk comes in. Next slide, please. Thank you. So when we look at Maryland snapshot, again, prematurity and why human milk matter. Maryland's preterm birth rate, we just touched on that a little bit. Really, 1 in 10 babies in our state are born too early. And prematurity increases the complexity of feeding for these individuals. For moms, when there are NICU stays, there's separation between mom and baby. Pumping is initiated, which does take time and does take attention, which unfortunately can present opportunities for moms not to get the best sleep and rest that they deserve, which can increase the amount of stress and overwhelm that they experience. And stress intersects directly with lactation that we've already identified. The American Academy of Pediatrics' most recent clinical report emphasized how mother's own milk, fortified when needed, is optimal for very low birth weight infants. So we want to try to support them as best as we can. And when mother's milk isn't available, pasteurized donor human milk is recommended. So when we say make human milk the standard of excellence, this is evidence-based from a neonatal medicine perspective, not ideology. It actually does matter, and we want to help support that. Next slide, please. Thank you. So, the American Academy of Pediatrics and ACOG both indicate that exclusive breastfeeding should actually take place for up to the first 6 months. That's with no introduction of formula or anything else. Now, 1 in 8 women report postpartum depression symptoms. And we already know that perinatal mood and anxiety disorders affect 1 in 5. Now, breastfeeding does influence the maternal mental health and the production or release of breast milk. And for some families, lactation support, bonding, and confidence may be low. So us helping to provide education, to normalize thoughts and feelings, and to provide reassurance through effective and therapeutic communication does matter. This is not a trend. This is evidence-based care. And in multidisciplinary avenues, whether it's from the pediatric perspective, from the OBGYN perspective, nurses, doulas, midwives, caregivers, partners, we all have a place to play in helping the mother and child effectively breastfeed together. Next slide, please. Thank you. So I mentioned Diane Spatz a little earlier, and she is one of the breastfeeding gurus that are out there. And as mentioned, she has an approach to protect the dyad, the mom and baby, protect the milk and protect the mind. We follow that approach. We just change it a little bit in that we want to protect the mind, nurture the mother's mind so that we can help her be successful to nourish that baby with her own breast milk. And understanding the interconnectedness of breastfeeding and maternal mental health is crucial. Each can significantly influence the other. Emotional well-being can affect breastfeeding initiation during the confidence factor, while breastfeeding experiences, whether positive or challenging, can in turn shape a mother's mental and emotional health. And so, again, strong, consistent support systems are essential in this process. When families feel heard, respected, and supported, they are better equipped to navigate challenges and celebrate successes. Does that make sense for most people? Just put a one in the chat if that makes sense. All right, next slide, please. Perfect. So when we look at, and now we're going to take a deeper dive into perinatal mood and anxiety disorders, which we've touched on a little bit. And perinatal just simply means the time in pregnancy and up to the first year of postpartum. And during that time frame, these conditions can certainly present. And the perinatal mood and anxiety disorders encompass quite a few. Depression is one, and we hear about that often. And we've also heard about postpartum depression, which falls in that category. Anxiety is another, and with that also encompasses panic attacks and general anxiety, excessive worry, that type of thing. Obsessive compulsive disorder, OCD, post-traumatic stress disorder, PTSD, we've heard those acronyms. Bipolar disorder, which is mood swings between depression and mania. And then postpartum psychosis. And although rare, it is a very serious condition and one that we should certainly act on. Now, that being said, some of the risk factors for parents having these conditions can certainly include previous mental health history, right? If there's a previous mental health history, then it puts someone at a greater risk for having those symptoms or concerns present in the postpartum period. Hormonal changes. Well, during pregnancy and obviously after birth, those hormones are constantly changing. Immediately after the baby is born, there are shifts that take place that moms can't control. Relationship stress. So that depends on who's available. Who are these relationships with? And if there are concerns present, that could be a barrier for mom really focusing, connecting, and then providing what she needs to the baby. Birth complications. Wow. That one I have to take a pause on. One of the things that I'm grateful to say is that I have the ability to still work bedside in the hospital alongside having mainline maternity in the community. And because I have that option, I unfortunately am privy to a lot of the birth complications that happen for our moms and sometimes even for our babies. Shoulder dystocias sometimes present and affect babies' abilities to even get in certain positions to breastfeed. If they have a broken clavicle or if they've been in a particular position in utero and have stiff neck or what we call torticollis, those things can play into it. And then major life stressors for the mom, We're living in a really challenged climate today, guys. Major life stressors exist for us that are not pregnant. Can you imagine how it is for those that are pregnant and then the ones that have the baby afterwards and some of the challenges that they may face, especially those that may come from another area or are of our Hispanic population? There's a lot of stressors happening right now, and they're real. And then obviously breastfeeding difficulties and social support. Those are all risk factors that can absolutely affect what happens between mom and baby and the breastfeeding journey. And this matters to us clinically, right? In the voice of PSI, we must differentiate between baby blues and perinatal mood and anxiety disorders. Baby blues generally last up to 2 weeks. They're not as intense. They don't necessarily cause moms to not be able to function appropriately. They're temporary. Perinatal mood and anxiety disorders are a different beast. ACOG says to screen broadly, not just for depression, but for other things that could be interrupting and disrupting that family. And the March of Dimes says mental health affects prematurity, feeding success, and infant outcomes. And we know that. So our practice with mainline maternity care is really to promote mental health and breastfeeding because they go hand in hand. And this presentation is to help be a bridge to help individuals understand when we nurture the mom's mind and that atmosphere, we can then create an ideal atmosphere to nourish the baby. Next slide, please. Thank you so much. So, mental health symptoms and challenges. We have a few women in the room today. I'd just like to take a pause and ask a question. Is there anyone in here that has breastfed? And if you have, put a 2 in the chat. Let's see who's with us today. Awesome. Thank you guys. Thank you for identifying yourselves. Thank you for, your providing breast milk to your baby. And if it's okay, I'm just going to ask for a couple of things. Share with me in the chat some of the symptoms or challenges, if any, that you experienced. Some of the symptoms or challenges, if any, that you've experienced. And we'll just give a couple moments to have people reply. Low milk supply. Yes, that is a real challenge. And one that we can certainly speak to in the early days after birth. Lack of support from employer. That is real too. And one of the reasons why advocacy is very important, so that we can hopefully have more employers that are on board with ensuring that moms get the support that they need. Supply drop while pumping due to life stress. Yes, we just talked about how stress does affect breastfeeding, and it can absolutely affect the supply. And actual nursing the baby was fine. And usually it is. The mom and baby coming together has so many benefits for both. But these real world stressors do affect how we're able to provide breast milk to our babies. So thank you guys for sharing. I really do appreciate that. Let's see. My first child, 16 years ago, I was only able to feed for 3 weeks. I was suffering from postpartum and did not know. Oh my goodness, and had no education. Yeah, that's real. I had support from help from outside family consultation. I felt alone, so I gave up. Katrina, I'm so sorry that happened to you. And I'm sure that you know you're not the only one that that's happened to. And when people don't have education, they kind of go with what they think they know. And sometimes it's great, and sometimes it's not. It can actually be more damaging and discouraging. So support is something that we absolutely highlight. And at the end of this presentation, we're going to give you guys some Maryland support options that you can tap into. Thank you again all for sharing. Next slide, please. All right. So recognizing urgent mental health needs. We just identified perinatal mood and anxiety disorders. You guys, some of you shared what your challenges may have been. So now let's talk a little bit about the difference between distress and danger. Many parents experience sadness and panic attacks, guilt, and those are okay, short-lived, right? They're serious symptoms. And with counseling, treatment, peer support groups, just talking it out sometimes, that could be enough. But things can get worse. And we do need to act immediately. If there are concerns of self-harm, thoughts of harming the baby, thoughts of harming anyone else, hallucinations, seeing things that aren't there, delusions, auditory hallucinations, hearing things that are not there, complete confusion, and extreme agitation. These are things that are a concern and should be brought to the attention of someone as soon as possible. Postpartum psychosis is rare, but it is a psychiatric emergency, and those individuals need help right away. The American or ACOG, I always want to say it all out and then look at the numbers, the letters and spell it, but ACOG emphasizes that screening must be prepared with the urgent response pathways when psychosis or suicidality is present. Again, this is a medical, urgent, and treatable condition, but time is of the essence and people need to move fast. Next slide, please. Thank you. And while we're talking about perinatal mood and anxiety disorders and what comes with that, I also want to take a moment to interject here. Breastfeeding after infant loss. Sometimes when things go really wrong, there is not a baby that comes out of it alive, right? But the body does what it does and it still makes milk. So in this situation, it's a choice for parents to decide to suppress, not do anything that's going to cause more milk to come in, to express and donate for those who have a passion of helping other babies as well, and for any rituals. Okay, infant loss changes everything, but the lactation physiology doesn't stop immediately. And sometimes those parents need help too. So again, families have options, but sometimes they may not even know about the options. Sometimes there may not be conversation on what to do next. And as clinicians and individuals who help support these families, we should start to have those conversations as well. It shouldn't be when they're discharged from the hospital and they're home and milk supply comes in and then they're like grieving the fact that their body is still responding to a baby that's no longer there. It can certainly intensify perinatal mood and anxiety disorders and the recovery process altogether. So we don't want to have, rush decisions, and we don't want to cause people to grieve differently at home. If we can help and provide information that even in small bits and pieces can be introduced while they're with us, It will help them better for when they do go home. Next slide, please. Thank you. All right. So, as we talked about, breastfeeding is an emotional journey. And sometimes it looks like this. Moms may be completely overwhelmed and don't know exactly what to do next. It's not about nutrition, right? It's about what's going on emotionally. And that gap can certainly affect and produce more barriers. Baby blues, we talked about, it's common, it's short lived. Perinatal mood and anxiety disorders are a little heavier. And sometimes moms may think, oh, I'm supposed to be able to handle this. I am supposed to be grateful I have a healthy baby. And they may suffer in silence, thinking that I should be able to do this. But sometimes that's just not the reality. Mental health and breastfeeding doesn't require or need extra care. It demands essential care. So again, just making sure that people are informed with the education and aware of the support systems that are available for them. If a mom is crying every feed and a partner's panicking, if baby's not getting enough or not gaining weight, we don't want to have them just push through, right? We want to assess what's happening. We want to offer support and we want to guide them in a way that's going to have them reach the goals that they initiated, which was providing breast milk to their babies. Next slide, please. And in that, we can't forget about the dads and the partners. And we actually respond differently, guys. I'm sure you know that, right? Just kind of dealing with the opposite sex and every other aspect of what happens. But sometimes men may not experience things the way that we women do. So dads may present being a little more irritable or angry. They may withdraw or decide to just throw themselves into something else, whether that's work or a hobby. They may decide to just completely shut down and not be home for whatever the reason they find to be outside as opposed to home. And so this isn't ideal for mom. It can make her feel more alone. Like, what would mention in the chat, when you're feeling alone, how can you, navigate what you're in? You may not even see it. So 1 in 10 dads are affected by perinatal mood and anxiety disorders. So if we think about that, 1 in 5 moms, 1 in 10 dads, if both mom and dad are experiencing it, then what do you think that might look like for the baby? How is those early forms of attachment and safety and security being addressed? So when I say this is really holistic care, when we talk about nurturing the mom to provide breastfeeding nourishment for the baby, it really is a holistic family support system because dads are affected as well. Next slide, please. All right, so now we're just going to take a little bit of a turn. We talked about the mental health perspective in terms of where we are. The body does what it does normally, naturally. Perinatal mood and anxiety disorders are present, sometimes even before pregnancy is conceived. Now let's talk a little bit about the hormones that are taking place with this. There are 2 primary hormones that we care about in lactation. One is oxytocin and one is prolactin. Prolactin helps make milk and promotes caregiving focus. So kind of think about prolactin, so the word pro, and production. Prolactin helps with production, okay? And then oxytocin, which supports the milk flow and supports bonding and supports release. So these hormones are not just about feeding, they're connected Two different systems, but both of them need support. Next slide, please. Thank you. All right, so when we talk about oxytocin, again, this is the letdown hormone. The source is in the posterior pituitary. Oh Lord, my P's are running together. Posterior pituitary, and this is a stress-sensitive hormone, meaning stress can absolutely interfere and inhibit oxytocin release. When the environment feels safe, oxytocin is there in abundance. It supports calm, it supports bonding, and it's great. But when they're stressed, birth traumas, inability to latch, lack of sleep, or moms feeling watched, judged, rushed, that letdown can pause, right? And if that happens, moms feel like my body is not doing this. I can't produce milk. I can't do this. They compare themselves to other people, right? And so that can begin to cause more anxiety and more stress. And then that cycle, again, it's vicious. And we want to try to disrupt it if we can. So when the environment feels stressful, oxytocin release can be delayed, affecting letdown, but not the production. We know the body can produce. So if we can correct those other things, we can actually help. This situation really just means that mom's nervous system is in a protection mode. And we need to break down the barriers that have caused that in order to allow her to feed effectively. Next slide, please. Thank you. So when we look at prolactin and the mental health relevance as it relates to that, prolactin is the milk-making hormone, right? We need prolactin to help produce what's in the body. And it is a supply and demand system. So as early as 16 weeks, colostrum produces itself in the body. Once it's there, when we demand or request it and the breasts are emptied, that signals the brain to make more. It also supports the caregiving focus. It helps many parents feel more tuned in to their infants. The emotional narrowing is really the protective focus. And this is biologic. Like this has its effects before we even get into latch issues. So when prolactin levels are supported through regular milk removal, the system is stabilized, more milk comes. When there's disruption in either mom and baby coming together, us utilizing hand expression, or having that mom begin to pump early after delivery, and there's missed opportunities for the breast to get expressed or emptied, then we can run into a little bit more challenges. And again, this is not failure. This is physiology. Next slide, please. And so here's where many families begin to feel confused. We talked about prolactin. We talked about pitocin. There's another chemical. It's called dopamine. And this is the reward chemical, right? When feeding is going well, when the baby is connecting, when moms feel good, there's eye contact, there's touching, observing. Dopamine reinforces that positivity and that behavior. Another hormone that we can refer to is cortisol. And this is the stress hormone that can interrupt that. High stress before, during, and after the delivery can absolutely delay letdown. It can increase pain receptors. It can amplify anxiety. So if feeding feels overwhelming, that doesn't mean that mom's weak. Again, it means that the stress system has been activated. Her body is going into protective mode and activated nervous system needs support, not shame. And this is where we can certainly help. Next slide, please. So postpartum stress happens. We want to be better with regulation. This slide relates to the body's stress control system, right? Those hormonal shifts are happening, and understanding the function on what's happening in the body, if we can explain to moms, short and sweet, of course, it'll give them what they need to continue to be successful. Listen, this is not you. This is what's happening in the body. Pregnancy dramatically shifts hormones. Birth is a physiological stress event. Postpartum sleep deprivation. It's neurologically destabilizing. So if we're not protecting your rest or sleep, then we're not protecting everything else, right? And this is why we want to support. We know that depression and anxiety are out there. We know that, in some instances, people are getting support and some they may not be. So from a provider and a practitioner perspective, this is why screening matters. This is why partnership matters. And this is why community support matters. These layered things will help breastfeeding success. Again, it's beyond just the technique of breastfeeding. And at this point, it's more about the nervous system and helping moms understand what's really happening in their bodies. Next slide, please. All right. Now, there are some people that should not be breastfeeding, and I won't spend a lot of time here, but contraindications of breastfeeding do exist, whether that pertains to mothers who have conditions that should not breastfeed, or there may be some additional conditions as it relates to the babies. But there are evidence of body for some people that should not breastfeed, and we want to make sure that we also kind of make sure that those people are supported. All right. Next slide, please. Thank you. Now, I'm going to ask a quick question in the chat, and that is, look at this mom's face. Just look at her face for a moment and type in the chat what you think is going through her mind. Just quickly, what do you think is going through her mind right now? She does look stressed, right? She really does look stressed. That was my immediate thought. She can certainly look a little frustrating. Yeah, this might be hard. Might not necessarily be what she thought it was going to be, right? And these things matter because it's in the moment. It's in the moment. Obviously, we recommend getting breastfeeding support before the baby is here. But I'll tell you, because I do work bedside, I do my own personal surveys with every patient and family that I interact with. And right now, I have a 94% rate of families that I have personally helped. When I ask the question, did you obtain any breastfeeding support or education, watch any videos or anything before they come in to be pregnant or come into the hospital to deliver? Yeah, 94% no. So that only gives us a small window of people who actually come into the hospital with education. So education is key. And part of what we want to do is get it out there. Get it out there. Sometimes doctors' offices can't do it. They're busy. Sometimes pediatrician offices may not necessarily have lactation specialists available or anyone in the staff who may have breastfed. So we want to look beyond the borders, the places that we've been in recently or in the past years, I say, and move into other areas. So part of what Mainline does is we're in the schools. We're talking to parents where they are. We're meeting them where they're at. We're in the churches. We're talking to congregations in terms of what's going on. breastfeeding, mental health, postpartum recovery, birth traumas, all of it. But if we can give more information, education, and support in all of the areas where women are, then I think we can be doing a little bit better for the state of Maryland and changing the outcomes that we had. Next slide, please. We don't want our babies to look like this, right? They want their baby to look like that. Look at that little face. We want this little one to be happy. So, as clinicians and practitioners and caregivers and all of the people that are supporting these moms, let's check in real quick. And how are we going to do that? A care model, CARE, a care model. The C stands for let's check. Let's check, is mom safe? Is the baby safe? Let's ask some normalizing questions. Since birth, how often have you felt down, panicky, on edge? Any scared thoughts about harming yourself or harming the baby? Again, screening matters. We want to assess what's going on with feeding. What's it feel like in your body? What's it feel like in your mind? Both, right? We don't want to make this a separate thing. They go together. For the R, we want to respond to both mom and baby and a diet center plan, offering options, not ultimatums. We want to support success, not make her feel any worse than she may already be. So, that being said, if breastfeeding is worsening, if mental health is getting worse, if no matter what we're suggesting, those moms are just heading in a different direction, then we want to reinforce the CDC's point, and that is treatment. E, we want to escalate. That E is important. We want to escalate to the people who can actually come in and help. I'm a breastfeeding counselor. I'm not an IBCLC, and I know my role, I know my lane, but I am surrounded by IBCLCs, not just in the hospital, but outside of the hospital, that when we are running into challenged moms, we can absolutely warm hand off to so that these young ladies are supported holistically. All right, next slide, please. I'm looking at my time. All right. Addressing latching pain issues, we talked about that a little bit. Again, that is just another escalation of services. Latching should not hurt. If there is pain there, it requires evaluation. It could be a miscommunication with mom's nipple and the baby's attachment on it. We don't nipple feed, we breastfeed. So we like deep attachments, and that's something that requires eyes on. You have to kind of see what's happening to address the pain and make the necessary recommendations, right? This is why our approach is assess pain early, observe a full feeding. We want to see what's happening when mom is latched and that baby is doing its thing. We want to adjust positions if we need to, reassess milk transfer, and again, connect to ongoing support. The time in the hospital is short-lived. We are thinking a way beyond that. Next slide, please. And we know that sometimes, again, in the hospital, express breast milk works too. If there's separations, if mom and baby are not together because of a NICU admission, if mom had a traumatic situation and had to go off to the ICU, but the baby's absolutely fine, right? Still doesn't matter. There's a separation between the two. And whether it's NICU or ICU led, when babies can't latch, milk production depends on early, frequent, effective milk removal. That's us. That's the practitioners. That's the individuals that are bedside, whether it's a doctor, a midwife, nurse practitioner, or PA, a nurse, a doula that's visiting, or the partner. Hand expression is important, and that's a tool that I want to teach you guys before we leave today. So I'm going to try to hurry up so I can get to that point. Next slide, please. All right, great. Diversity is a thing. We all know that, right? There's many of us, and there's more of us here in America. And again, the climate is ever changing. But From a cultural perspective, we want to respect everyone's culture from which they come and for how they child rear. Some cultures don't even talk about depression. Women do suffer in silence and they're expected to. But they're here now, along with all the other challenges. We too want to support them. We want to do whatever we can from a cultural perspective and certainly teach what we can to have those individuals provide the service that they want to their babies and to their families. And for us to provide culturally sensitive, inclusive care that fosters trust, reduces barriers, allows women and families to seek help, and ensures that the help that they seek and the education that they seek is evidence-based. And I can't say that enough, evidence-based, because that's what's going to help us form great families, great feeding, and ultimately change our communities. Next slide, please. Um, I hate to say it like this, but I'm going to. It seems like African Americans run a lot of races, and in some of them we lead, and some of them are not all good races. Disparities in breastfeeding is another one. Unfortunately, Black women are less likely to breastfeed, be introduced to it, have exclusivity, and we want to change that. I am a Black woman, so it's part of my personal mission to do that. And just a little known Cynthia fact, I became a teenage mom at the age of 15. I had my second child at the age of 25 in two different states. And in neither case was breastfeeding ever discussed with me. It wasn't introduced. In both instances, the nurse came in with a bottle and said, here's time to feed your baby, here you go. Or, oh, the formula's in the drawer, there you go. When you're ready to feed the baby, baby shows you signs, go ahead at it. Nothing as it related to breastfeeding my baby. But when I became a practitioner, I realized all of the benefits of breastfeeding. And so I like to share those as often as I can with whomever is willing to listen, because the benefits far, far reach into how that child develops in their life moving forward. Next slide, please. Perfect. Thank you. And so we want to nurture the parent. We want to protect the dyad, as Diane Spat says. We want to offer emotional support so that we can reduce stress. We want to regulate caregivers so that they know what's happened hormonally. It's something that just happens and we can support that. We want to include this in a holistic family support area so that we can help strengthen bonding and promote resilience. When parents feel supported, cortisol levels decrease. When cortisol level decrease, oxytocin flows more easily. When oxytocin flows more easily, milk is then ejected, which makes more milk, and that helps support that bonding and that physiology. So as a regulated caregiver is supported, that helps regulate the infant, right? If we can get mom to do what she needs to do here, it will happen here at the breast level, and the baby will get the benefits, and it'll be so effective for the family in general. Next slide, please. Thank you. And so maternal mental health screening is not optional. We want it to be done more. Not only do we want the screening to be done, and here are the tools to do that, but we want there to be some accountability. Don't just refer and say, oh, I filled out this EPDS screening, patient scored 10 or more. I'm giving a referral to, I don't know, Psych Joe, and then nothing. Sometimes these parents don't necessarily follow up with the recommendations giving. So we want to certainly check in. Hey, I know we initiated a referral. How you feeling? How things going? Did you make that appointment? Do you need help to do so? This is where your case managers really come in. You can tap into them so that there can be effective follow-up in the event that there may not be able to be that option with the providers' offices themselves. You can tap in social work. You can tap in case management. You can tap in your community support providers, those individuals that will help you when you need help to ensure that your patients are doing well. Next slide, please. And supportive communication matters, right? We don't want our moms to feel like they're kids and they're being scolded. We want to support them using trauma-informed, non-judgmental language. We want to normalize the changes, the physiology changes that are happening in their bodies. We want to listen to their stories and validate their feelings. And we want to ask open-ended questions pertaining to what's happening. We really want to support them as best as we absolutely can and not have them feel like what is happening and what they're doing is wrong and it's bad and they need to be scolded. Next slide, please. And so we know the benefits of breastfeeding. We know the milk matters. There's 3 ways to get milk out. 3. Latching the baby to the breast. Number 1, most ideal. But when that's a challenge or not necessarily able to be done, we can go to option 2, hand expression. And that's literally it, using the hands to express milk out of the body. That is option 2. And then option 3 is pumping, utilizing a breast pump to get milk out. But clinically, hand expression can relieve engorgement, it can soften the areola, it can provide immediate colostrum to the baby in those very early days. It can help moms get milk out, which will then help the body produce more and put those milk or lay the foundation for those milk making stores for months beyond the birth. So that's what we want to teach you guys today. And that is going to be our next slide, please. Awesome. So I know we're running very short. Certainly, I want to give the option to everyone to view this video. I think it's about 6 or 7 minutes, which is going to take us over time. You guys will get the access to the videos, but just to state it, it's World Health Organization. There's 2 specifically that I refer to. One of which is a referral source that we use at Johns Hopkins. And again, that's where I work. So that's what we use. And that is the Global Health Media video on how to latch the baby to the breast. Outside of that, Mainline also supports our families with showing the World Health Global Media video on how to express milk from your breast. Really simple technique. I'm just going to show you really quick for you guys that can see me. And I'll just ask you to kind of like mention in the chat. I'm going to bring this down a little bit. I'm going to molest myself, guys. So that's my disclaimer, okay? I'm about to molest myself. So hands holding the breast. There's a C that develops here with your thumb and index finger right across from one another. The hold on the breast should be outside of the areola, not on the nipple level. When we hold the breast, you're supporting it. You literally just push back toward the chest wall. So hold, push, press. The press is the compression on the breast, which then helps the milk express from the breast. So I'm sorry that I was a little long-winded and didn't get an opportunity to show the video. When you get the slides, I absolutely 100% encourage you to watch it. Not just the hand expression video, but I also encourage you to watch the video to help moms understand what it looks like to effectively latch a baby to the breast. If they've never seen it modeled, if they've never done it themselves with other children, and if their support system surrounding them didn't have those visuals present, it might be a little hard for them to understand the concept and think that they're doing something that could be actually hurting the process. So those are two really good videos. I absolutely recommend you guys watching them at some point. Next slide, please. The next slide refers to some support that's here that you guys can tap into, and I would absolutely encourage um, based on what's here locally and not. And then next slide, please, refers to those referral pathways. As I mentioned earlier, we want to make sure that the referral is happening, but more importantly than just initiating a referral, follow up. Follow up, follow up, follow up. We need to make sure these moms are doing okay, and we need to check in with them. We need to certainly continue to support them. And if practices can't do it, that's fine. That's what you have people in the community like myself and all these other organizations for. We can absolutely do it. All you got to do is tap us in. So next slide is just resources based on all of the evidence that we've gotten. And then our last slide is just a simple thank you. I apologize, apologize, apologize. I know this was a little over, and I do apologize for that. But as you guys can probably tell, I'm very passionate about not just breastfeeding, but certainly our mental health for our moms, because if they're not well supported, then it could certainly trickle down to the baby not feeling safe, secure, getting their needs met. And then that's a whole nother conversation on the effects of not thriving for the babies when they don't get what they need. So that is it for me. I will turn it back over to my leading ladies, Roni, and certainly if there is opportunity for questions, we can go through a few. If you guys, certainly reviewed a video at any point and would like to share your feedback based on what you thought, that would be great. But yeah, that's it for me, guys, and I hope that there
Yes.
was something learned out of this.
So much. Thank you so much, Cynthia. This was so informative, engaging, and it was just overall such a great presentation. I know everyone benefited from it. So I know we are over, but so much was shared. I just want to maybe open up the floor for a question or two or a thought that anyone has. I don't want to leave us hanging, but if anyone has any questions, feel free to drop it in the chat or any thoughts, anything that you want to piggyback off of, and we'll just share it super quick. Thank you again so much, Cynthia. This was amazing.
Oh, you're welcome. You're welcome. And again, I apologize for going over, but it definitely is something that is near and dear to my heart. And I want to just make sure that, people are aware of the benefits and certainly some of the challenges and how we
Yes.
can do better to help support mom's mind and nourish her baby.
Yes, and I'm seeing one question. I'll answer it. Yes, you will receive a recording of this. Thank you, Audrey, for answering in your inbox. Sometime this week, if not today. And yes, we will have it up on YouTube. I think YouTube automatically does, subtext. I'm forgetting the name. It's escaping my mind, but I think it automatically does that as well too. But thank you all so much. I'm not seeing any other questions, so I will just share quick announcements and then we'll close. Again, thank you all for joining our March webinar. Thank you, Cynthia, and Mainline Maternity. Audrey already posted some of the information from Mainline in the chat, but we will also send that out as well too. We want to thank you all for being a part of our webinar series. As was shared in the chat, certificates of attendance for today's webinar are available. These are not CEUs, but these are certificates just to show that you were here and present today. If you are a provider, a professional, or just an organization in the community that would want to do something similar, come and present for Healthy New Moms, you can click the link in the chat and we will get back to you. That's where you can share information about yourself, what you would like to present, and we can kind of go from there. We look forward to working with you all in Maryland, in the communities, to continue supporting mothers. If you have any questions for Healthy New Moms, or you want to share anything, you can email us at info.hnm@mhamd.org and someone from our team will get back to you. So again, thank you all so much for being here. Thank you, Cynthia, and I hope you guys have a great rest of your day.